The change I've chosen to make is to implement an oral care record chart, including daily assessment. So moving on to the project itself. Observation on the ward was done for a week. I just worked on the ward and established how much mouth care is being done, how well it's being done, who was doing it, how they were doing it, and what they were using. I spent this week to build relationships with the team of staff and gain advice from the sister on the ward. So today I'm going to discuss my work up to now, which is encompassed in one PDSA cycle. So my plan. The objective was to test a change idea on a medical ward where I'm currently on placement. It involves all nursing and healthcare staff on shift. They had no training, but they did have an introduction of change at every safety briefing. I decided to follow up all the results by myself because it's only a small-scale project, and I predicted at the end to have valuable data feedback from staff following the change. This was the chart that I devised. It was implemented on the ward, and it was introduced at the number of safety briefings, so they knew what to expect. It includes date and time, indications for mouth care, the condition pre-mouth care, so it's got an assessment pre and post, also the action taken and initials. So basically it just tracks what's being done, when it's being done, and is it making a difference. I implemented the chart over a period of 4 days. It was only given to those patients who had been identified at risk based on their nurse and admission documents, or if they were for all care. The chart was put at the end of clipboards alongside intentional roundings and fluid balance, so it was easily visible to all staff. After I've done it, I've now looked back. There was a mixed outcome following the very brief introduction of my chart. The positives included that compliance of filling in the form are very, very good on days 1 and 2. Some of the nursing and healthcare staff were really receptive of my idea. They filled in the charts really well. I had very positive support from my faculty advisor and also my ward sister, who advised me and gave me support throughout. When it was used well, it prompted staff to return to patients after 2 hours and moisten the mouth. Patients appreciated the time being given to actually brush their teeth because it wasn't happening every day. Mouths did seem to appear in a healthy condition if it was done properly. I did, however, have some negatives. By day 3 and 4, the charts were being ignored. They weren't being completed at all. Some of the staff did just seem disinterested by the subject. They didn't seem to think it was a big idea at all. Some saw it as another piece of paperwork, so it was time-consuming when they had to fill it in because it was just another form. And they also compared it to the intentional roundings that Dion's been talking about, and they mentioned mouth care too. So I took this advice on board. If I'd have thought, before I started my project, that there was going to be a negative response in any way at all, I would have been really disheartened, I think. I would have felt like I'd failed. But actually, when I look over the charts after they've been filled in and I've spoken to the staff, I've realised that I can learn an awful lot from their feedback and from doing this first part of the cycle. So I took their criticisms constructively. The positive impact that I saw as well on one particular patient, it's filled me with pride because her chart was filled in really well for 2 days. It was done 2 hourly by a couple of nurses and healthcare assistants. And after the 2 days, her mouth was in a much better condition. She was actually eating and drinking better after it. And even though this was only one person, I feel like I made a difference by doing that. And so for me, the effort was all worth it, and it spurred me on to go into practice now and complete my second PDSA cycle.